So again, welcome. I'm Kristen Patterson, for those of you whom I haven't met yet, and I lead PRB's People, Health, Planet focus area. And thank you again for joining us today. So women's empowerment unexpectedly became a focus of my life when I served as a Peace Corps volunteer in a rural village in Niger, West Africa for 2 years, more than 20 years ago. A life-changing experience that continues to inform my work today. Nearly everyone we know has been affected by the COVID-19 pandemic that is sweeping the globe, straining health systems and people's abilities to maintain their livelihoods. Today, we will hear from leaders in environmental conservation, global health, and women's equality to learn about the current challenges in the communities they share, in the communities they serve. Despite the heroic efforts of leaders and residents of many low and middle income countries to mitigate and respond to the pandemic, people in rural communities that depend on global tourism for their livelihoods face great challenges, which won't abate anytime soon. This webinar is designed to help us think outside the box about how to respond to reproductive health and livelihoods needs in last mile communities near national parks in rural areas. I hope you come away from this webinar with a couple of concrete actions you can apply in your work. It's quite important to emphasize that holistic solutions that are community-driven are designed to meet people's health, livelihoods, and natural resource management needs. Cross-sectoral integrated approaches to development improve equity and are responsive to a community's self-identified priority needs, which in rural remote areas often includes voluntary demand-driven family planning. So what makes people resilient? Here are a few key components of resilience that were identified in a recent publication in the journal Population and Environment that focused on household and community level resilience in communities in rural Western Tanzania near Mahale Mountains National Park, adjacent to Lake Tanganyika. During our webinar today, we will hear how reproductive health, food security, gender equity, and environmental conservation interact with and contribute to resilience. Today, we will hear from 4 excellent leaders. First, we have Kadu Subunya, who's the CEO of African Wildlife Foundation, a conservation NGO based in Nairobi, Kenya. Next, we will hear from Jason Bremner, who's the Director of Data and Performance Management with FP 2020 in Washington, D.C. Then we will hear from Latanya Mapp-Frett, who is the President and CEO of Global Fund for Women based in San Francisco, California. And finally, we will hear from Gladys Kalema-Zikusoka, who is founder and CEO of Conservation Through Public Health in Uganda. So Kadu, I will stop sharing my screen and hopefully you can share yours.
Thank you very much. I'm going to share mine. I guess you all can see it, no? Are you able to see my screen?
Yes.
Perfect. Okay, my presentation is good evening and Christine for organizing this and giving us the opportunity to discuss this very pertinent issue. Good evening, everyone. My presentation is going to be more about Africa because that is our work. We work across the continent. It's going to be touching more about national as well as community level aspects, but I'm going to state more at a continental and national level. But I would like to start by sharing my perspective on the changes taking shape in Africa, what I believe it means for how development, especially conservation health, must work in the future. Africa, as you all know, is going through a transformation that has created opportunities, unlike any other experience in my lifetime. For several years now, the African story has been one of raising economic growth, infrastructure development, and entrepreneurial innovation. Across Africa, we see that people are taking aspirations to heart. Not only are we healthier as Africans and living longer, but we're also driving economic progress forward in so many ways. More free elections, best educated people, especially young people on the continent, historically. And we're optimistic about the future of the continent. But the story of Africa resurgence has happened at the same time when Africa has lost most of its wildlife and wildlands. And this has put Africa at a crossroad. The need for additional infrastructure, as well as more land for agriculture, human settlement is real. Africa is now making real choices about how and where development will occur. What areas of Africa should be protected and which ones should we trade off for development? What's the role of wildlife and wildlands in Africa's development? The future, therefore, of these unique continental natural resources is directly tied to the decisions Africans are currently making on economic development and population ascent. The continent loses rhinos, for example, more than 1,000 a year. We are left only with 25,000. This year, we found out that the giraffe population has experienced a rapid decline, 40% in the last 30 years, and they are already extinct in 7 countries. Elephants, you know the story, 1.3 in 1970s, in most of our lifetimes, dropped to 600,000 in 2005, and now they're estimated at around 400,000 only, and still dropping. It is my belief that if Africa does not quickly and directly tackle issues surrounding conservation, health, and development, at this time when we are at our formative stage of economic development, growth, prosperity, potential positive socio-economic, healthy, political, and environmental gains will be short-lived. The outcome of the discussion about whether to link conservation, health, and development or not will determine what will be left of wildlife and wildlands on this continent. Our vision, therefore, for Africa is to see the quality of life improving with sustainable livelihoods as people continue to coexist peacefully with wildlife and wildlands. The change impacting modern Africa I've described has focused our vision as an organization in recognition that the debate and focus of Africans, including communities and people living alongside protected areas, has shifted from strategies of conservation to sustainable economic transformation. That modern economic narrative is driving the major threats to wildlife on this continent. That leadership of conservation must therefore be with people who ultimately bear the cost and reap the benefits of action. These are communities, protected area authorities, national governments, all the rights of our resource base. Our strategy has informed by the theory of change that directly connect people to wildlife and wildlands, breaking degrees of separations between people and nature, and creating ownership, transparency, and demonstrated impact, driven by the fact that we can only be successful if our work is to assist governments and people to navigate a transition to economic modernity with the significant representative of wildlife and wild places. COVID-19 has made it clear that humanity is dependent on nature. The interconnectedness of nature and life on Earth infuses every part of our lives, our well-being, the health, food we eat, clean water, clean air, sometimes the shelter. Although today's world is quite rightly focused on financing and facing the immediate threat of COVID-19, it's important for all of us to acknowledge the planet is facing a deeper and longer-term crisis rooted in how humans relate to nature. While African leaders grapple with how best to protect and save lives while avoiding financial ruin, the continent is leading industries. As we shut down the economies, are operating at less than percentages they used to. But the tourism industry is the most affected. 1 million people around the continent depend on tourism. And it accounts for 6% of GDP in places where we work. And in most governments, it represents 30% of foreign earnings in many countries in Africa. So supporting conservation now means supporting health economies, individual livelihoods designed to thrive and respect planetary and environmental boundaries. Our mistake has been viewing natural resource management exclusively as an environmental concern. We need to acknowledge that nature degradation is often a symptom of deeper underlying forces involving political, social, healthy, and economic dynamics tied to development and broader patterns of land use. COVID-19 could be the beginning for us to position conservation as one of the solutions to global public health security. It's our insurance against future pandemics. It's the firewall between human beings and the next COVID-20 or 21. This acknowledgement will depend on how we galvanize the political will to reflect about the various costs we are going to incur: social, environmental, health, and human. And to think about what's going to happen when our most precious assets, the natural resources, are depleted. We would like to change this. Then we need to work together. The young people who are the majority on the planet, and especially here in Africa, are the guardians of the future, and they must step up, disrupt the status quo, take space as active participants in conservation at the highest level. COVID-19, we have seen youth taking lead to support communities in public health awareness, mobilization of funds. This shows that they have a drive and interest. We need to support them to scale up these initiatives and for greater purpose. African leaders and businesses decide how to respond to the economic impact of COVID-19. It's critical they do not cause long-term harm for people and the planet. Instead, they should take advantage of the opportunities to accelerate the transition to more sustainable societies and economies. Our leaders must rise and include wildlife and wildlands in our environmental agendas. COVID-19 has shown us how flat the world is. From a town in China to the outskirts of Scotland to a small place in Mukono, where I come from in Uganda, all of us are in masks, social distancing. The solution, therefore, is going to take a global effort. I'll stop at a personal note. I have sometimes been accused of putting a high premium on wildlife than human beings. At other times, I've been outrightly dismissed as an enemy of development or as an African with a foreign agenda. All these are not being the case. I hope today, as we discuss further, we will demonstrate the connection between conservation and development that encompasses social well-being, that includes health and education. Thank you very much, Christine, and thanks for listening. I'll stop sharing.
Perfect. Thank you, Kadu. I think Jason, you're up next, please. And again, for all of the participants, thank you for staying on mute, and please go ahead and start putting questions in the chat box as you think of them.
Thanks, Kristen. Thanks, Kadu. It's an honor to be with my fellow presenters and all of you today, and to speak after Kadu and those inspiring words. After a long journey of working on population health and environment issues, today I'll actually put on my family planning hat and very clearly talk about COVID-19 and what we know about impacts on family planning. Those of you who aren't familiar with Family Planning 2020, just an introduction to this global partnership, which was formed in 2012 to accelerate progress in family planning, meeting the contraceptive needs and choices of millions of women, hundreds of millions of women across the world's 69 poorest countries, both Africa, Asia, Latin America. And this journey to now where we are in 2020 has been one of acceleration and progress. As of a year ago, the last time we assessed progress, there were 53 million more women using contraception than when we started in 2012. That had a huge impact on women's lives, on their health and well-being, their livelihoods. And we had reached a watershed mark of the most money ever coming from donors for family planning at 1.5 billion US dollars. But the question is, now here we are at the end of our Family Planning 2020 journey, and how has COVID-19 impacted that progress? This is not an easy question to answer, but I'll try to give you some quick insights today. We have scrambled to put together an impact task team to assess this question. We've focused on 4 principal themes or objectives. One, to get a sense of the impact on data collection. Much of what we know depends on household surveys, on information coming from the field. And we do know that all household surveys that we depend upon have been suspended. And so we do not have our sentinel systems there to give us signs of impact. We're thus looking to government and private sector health management information systems, that basic level of data that is collected at a clinic and travels all the way up eventually to a national system to give us insights. We're trying to monitor impacts on supply chains, or those health commodities, the health products that make family planning possible. And then we're using models and scenarios to estimate impact, to advocate for family planning as an essential service, and to ask ourselves what needs to be done. I will go through just quick results. We had our first meeting on Friday where we got insights from partners and from the field. And so I actually want to just step back 1 second and say that on the modeling, some very early scenarios suggested that even a 10% reduction in contraceptive use, so a 10% reduction in low and middle income countries, would result in 49 million additional women in the world having an unmet need for family planning. And that would result in 15 million unintended pregnancies in this year alone. So that's a considerable impact of just a small decline in services. So what have we seen? Well, first to say that some of the private sector providers that you all would know well, like the International Planned Parenthood Federation, as well as Marie Stopes International, are 2 of the early organizations that collect their own data from clinics. And I'm going to just focus on the 2 red boxes. IPPF did a survey of all of their member affiliates. This would be the organizations in a country that are providing services under IPPF umbrella. You can see that as of early April, about 1/5 of static clinics across 100 and I believe it was about 140 responding organizations, about 1/5 of clinics were closed, meaning no service is being provided. About over here, I'm going to point to this, about 1/3 of the member affiliates reported shortages of key commodities, meaning the contraceptive methods were running short in their supplies. And this was partly, and I'll just point down to here, partly due to them being used up and also because of delays in customs and shipments. So I'm going to come back to that point. When we turn to MSI, or Marie Stopes International, they have now actually charted out 2 months of results on the services they've distributed. And what I'm showing you here are comparisons between March and April and what they had forecasted to deliver in terms of services. East and Southern Africa being the ESA, West and Central Africa, Asia, Pacific Asia, and this is India. And you can see a wide variation in the impact of COVID-19 on the services provided. And this going from about 10% fewer services than they had forecasted in West and Central Africa with the smallest impact, all the way up to almost 2/3 of services or a decline in Pacific Asia. In India, MSI here this is referring to largely condoms and pills, and you can see that a full lockdown has nearly stopped all of their service provision. So what does this mean for women? Because that's just the services provided. I'm just going to turn to another partner's data. This is an organization called NIVI, and this is results just from India. To deepen that result from India, what do we know about what women are saying about trying to get services? Just going to point out 2 quick things here. First, that NIVI was asking in mobile phone-based conversations, were you able to seek services at a pharmacy and receive a method? And first of all, you can see that despite the closure of the MSI clinics, about 50% of women in India in early April were still able to get the method at a pharmacy, okay? But that meant 50% could not get their method. And when asked where they or why they wouldn't go to a pharmacy within the next week, this is just that 50% that hadn't got a method. And I think that Kadu pointed out this potential challenge of economics. It wasn't as much about the lack of a method, but much more about lack of money to pay for a method, or just a concern about safety and fear or the lockdown itself. So I think that given those economic impacts, this ability to pay could become a bigger issue. So finally, how are we using all of this information to ask ourselves, how can we mitigate this impact? Colleagues at Avenir Health have created a new online tool, and several others are creating tools as well, that can help countries to model the impact of changes in services and changes in health-seeking behavior on supplies for contraceptives. And they've looked at several scenarios, and I'm just going to focus on one because I think it's an important one to think about. If someone was anticipating that they may not be able to get contraceptives in the near term, contraceptive pills, one thing they might do is be provided with instead of a 3-month supply, they might be provided with 6 months or a year's worth of supply at a single point in time, so that they wouldn't have to visit the clinic more regularly, so that they could be assured secure access to contraceptive. But that front loading of distribution, you could imagine then, could deplete a system, and when the next person goes to get that method, you have a shortage of methods, meaning you want to make sure people are safe and secure, but in doing so, you've got to think about the long-term impacts on the availability of those methods for other people. This tool allows countries to think through those scenarios and to start planning for them. So lastly, as we move forward, what are we anticipating in the coming months? You saw private sector data here. The public sector is a little bit slower to and they're gathering so much more data. So we are now starting to look at public sector, meaning the government health system data, to try to anticipate impacts. We're starting to look to innovative surveys to assess changes in women's health-seeking behavior. We'll be closely monitoring the impacts on supply chains, which I'm happy to say, despite some initial real disruptions in manufacturing and shipping, are starting to come back online. The biggest challenge right now has been ports, shipping, and moving things while the manufacturing is now coming back online. And then as we do this, we'll start to update models and scenarios and move from advocating for family planning as an essential service to thinking through that long-term response to ensure that women have access not just this month, next month, but for the year to come as we continue to suffer through the effects of the pandemic. Thanks, and back to you, Kristen.
Thank you, Jason. That's very helpful insights and data. Thank you for sharing that.
I will stop sharing now.
Okay, stop sharing, and then it's on to Latanya and Anja. Go ahead and start sharing your screen, please.
Thank you, Kristen, and good morning. I'll try, as Anja gets the video up, I'll just start in, and thanks to the panelists from AWF and Family Planning 2020, and I'm from Uganda. I look forward to hearing from Gladys in a minute. Again, my name is Latanya Mapfret, and I'm at Global Fund for Women, and many of you know Global Fund for Women and the work that we do to strengthen gender justice movements and to shift power, privilege, and perception, and create what I hope is meaningful change that will last beyond our lifetimes. We fund grassroots movements fighting for justice in their communities. And over 30 years, we've supported more than 5,000 grantees and organizations in more than 175 countries. I have to just pause for a second, and given current events, I think it's important to lift up human rights as a cornerstone to this conversation. To not address this first would miss the point, which is until inequality is addressed, nothing we do will be sustainable, whether that's climate justice, because it's interlinked extensively to racial justice and economic justice and reproductive justice and gender justice. So I'm going to take a couple of minutes to kind of talk about those linkages between gender and climate, because it's so profoundly related to what's happening all over the world, whether that's COVID-19 or much of the protests that we're seeing around the world around racial justice. Grassroots women lead organizations that we support because they live at the forefront of the climate crisis and its effects on their communities. As an organization, we're trying to prioritize women's leadership in the climate fight. And in particular, we're focusing on strengthening the resources for women farmers in order for them to lead climate resilience and food security in their communities. In our work, we see an amazing amount of interconnectedness between climate and gender at every single level. As the climate change depletes resources, the increased competition will exacerbate endemic gender inequalities and push to destroy resources that local women, specifically rural indigenous women, and these are resources that they build their lives upon. And so hence there's a food security issue. Women, and particularly rural, again, and indigenous women, account for sometimes as much as 80% of food production in some developing countries. They're on the front lines of the climate crisis. So it's important for us to contextualize what's happening with COVID-19 as really adopting to the climate crisis and the effects in the lives and livelihoods of those living, particularly in rural areas. And so while it's hurting many of us all over the country, it's particularly going to have some profound impacts on those living in rural areas. Now, we're still learning a lot about the virus and its effects. It's clear, though, that women, girls, and marginalized communities are being particularly hard hit. In general, women and vulnerable groups are facing increased domestic violence, restricted access to reproductive health care and rights, as Jason mentioned, and a heightened caregiving burden. Some of the examples that we're seeing under COVID that are affecting women in speaking specifically to sub-Saharan African communities, we're seeing that the pandemic is in some places being used as a cover for violence and discrimination against minority communities. We're even seeing that in my own country. We're seeing reduced access, as Jason mentioned, to sexual and reproductive health care, and an increase in maternal mortality due to travel restrictions. And of course, we're seeing further food insecurity and reduced livelihoods under COVID. So our grantee partners are coming up with solutions in this multi-layered problem, including we're hearing about hotlines and communication campaigns for women facing increased gender-based violence during the pandemic. We're seeing village health teams that are now providing sexual and reproductive health care where they weren't before. We're seeing women distributing hygiene kits and basic PPEs like masks, and really just stepping up. So the bottom line is that women rise to the moment everywhere, that community-led response is key, and that grassroots groups must be better funded. Funders must support both the short-term response under COVID, but also the long-term infrastructure to combat this incessant inequality that lives in our world. Funding for local organizations is approximately 1% of all funding, and even less for women-led organizations and communities. So in discussing solutions, I thought I'd leave you with a clip from a film series that we just put out called Fundamental. One of the episodes highlights the work of Akilidata, which some of you may know. Akilidata is a women-led grassroots organization focused on empowering girls and young women ages 13 to 22 to become leaders in Kenya, including through sexual and reproductive health and advocacy. Through high school and university level programs, teenage girls and young women at Akilidata built skills to raise awareness about sexual and reproductive health and rights in their communities, and challenging norms and perceptions to help their peers take better control of their bodies and their futures. So take a look with me. It's only a very short clip.
Yeah, we left a very important part of our body here, Cindy. We left it, but we will discuss.
Some of the problems that Kenyan women face are issues to do with how much secrecy we treat our sexuality.
It's very empowering when a girl understands her body.
Those who hold cultures so much and they don't want to change with the changes will always underrate women.
If we who know what is right don't do it, it's not going to get done. It's going to wait for another generation.
Thank you, Anja, for showing that clip. We're very proud of the Akilidata model, and you can see both this full episode as well as other episodes around women leaders on fundamental-film.com. Many of you know Wanjiro, the founder of Akilidata, and Purity, who's their current ED. These are women leaders that we have to look to in order to ensure that we find solutions, whether it's a pandemic, whether it's violence around, violence, gender-based violence, or other issues. We have to lift up community-based leaders and look to them for solutions. I'll end with this. It's paramount to center the needs of women, girls, and marginalized communities and fund them directly to implement solutions in their own communities, whether that's in conservation, reproductive health, or livelihoods. We must stay interconnected, intersectional, and intergenerational. Thanks, Kristen. Back over to you.
Thank you, LaTanya. That's excellent. And I think, frankly, with a lot of what's going on in the US these days, that a lot of those lessons about being community-led and listening to the needs of local people is what's needed in our country too. So thank you very much. And Gladys, on to you, if you would like to share your screen. Perfect. We can see it.
Yes, and am I unmuted? Yes, I am.
You are. Perfect. Thanks.
Yeah,
Gladys.
well, thanks for inviting me to this exciting webinar that's looking at all the different sectors and how they can come together. We started conservation through public health in 2003 because we're concerned about disease transmission between people and wildlife. And CTPH promotes biodiversity conservation by enabling people to coexist with gorillas and other wildlife through improving their health and community livelihoods in and around protected areas in Africa and other wildlife-rich habitats. In this webinar, I'm going to talk mainly about what we're doing about the COVID-19 pandemic. As you've heard from our mission, what we do is very much what is happening. What we do can address what is happening in the COVID-19 pandemic right now. I'll focus on the gorillas. Kadu talked about tourism as one of the main ways that people are valuing wildlife. And gorillas in Uganda have really brought Uganda tourism back. You know, after losing so many animals in the 70s and 80s in the Idi Amin era, gorilla tourism brought people back to Uganda. And so when I talk about the threats to gorillas, they're the same all over Africa, but they're slightly different. They have a different angle when it comes to Uganda and Rwanda, where gorilla tourism is very vibrant. All gorilla populations have a problem of habitat loss. If you look over here, there's a very hard edge between the community and the park. And when it was created as a park, people were not allowed in, but gorillas still come out. And there is poaching in most countries where gorillas are found. They may poach gorillas, but in Uganda and Rwanda and the Virunga area, the main animals that are poached are duiker and bush pig, and gorillas get caught in snares for those. However, when working as a first veterinarian for the Uganda Wildlife Authority, we came across gorillas that got scabies. This baby gorilla died of scabies, sarcoptic mange, which the group picked up when they went into people's gardens to eat their banana plants. And once they get habituated for tourism or research, they lose their fear of people and they're more likely to move out. And because there's such a hard edge due to high human population growth in this area, which is about 300 to 600 people per square kilometer around Bwindi Impenetrable National Park, there's a lot of conflict between the people and the wildlife. And this scabies was actually traced to people living around the park who have very little health care. And looking at other diseases that great apes have picked up from people, there's been the human metapneumovirus infection in Rwanda, which happened in 2011, very recently. And it was traced to South Africa, so most likely tourists from South Africa. There's been a respiratory disease more recently in the wild chimps in Uganda, which resulted in 5 chimps dying. They think it came from the local community. There's been a human coronavirus infection in Côte d'Ivoire, and it was in the wild chimpanzees. They didn't die. They only got mildly ill, but it just shows that coronavirus can actually spread from people to great apes. There's been also coronavirus spreading to non-great human great apes, not closely related to us, but they've developed some mild symptoms in tigers and lions at Bronx Zoo. And what is most frightening about corona is that the ACE2 protein receptors in humans and great apes and other old world primates are exactly the same, which means that they can very easily contract SARS-CoV-2 that causes COVID and have similar symptoms, if not worse. So gorilla tourism is another way that people get very close to gorillas. So not only outside the park, like with the scabies outbreak when gorillas went out, but inside the park. For those of you who've been lucky to go to Bwindi Impenetrable National Park or anywhere else to track gorillas, you start off with a briefing very early in the morning when they talk about the 7-meter distance, how close you can get to the gorillas. And sometimes they also talk about disease and reasons why, which is part of the reason why there's a 7-meter distance, also to prevent behavior disturbance. And the tourists over here who are observing the gorillas under the 7-meter rule, which is very good. But however, we conducted research and found that although 98% of the time people are being told that they shouldn't get closer than 7 meters, 60% of the time people got too close, and 40% of the time the gorillas broke the rules. And because they get so used to people, some of them have known people since they were born in the group. And so it's very hard to keep people and gorillas apart. And so what we decided to do was when the COVID pandemic started building up and we got the first case in Uganda, we held a training workshop with the park staff of Bwindi. The Wildlife Authority actually initiated this. They wanted us to, they got together with the conservation partners and said, could we hold a workshop? So CTPH, we led the workshop training, working together with Mountain Gorilla Vet Projects, International Gorilla Conservation Program, and Max Planck, who have all been working in this area for very many years. And we talked about how do we upgrade the regulations. We only had the 7-meter rule, which was being broken all the time. So we thought maybe we need to upgrade things. And everybody around us was wearing masks. And we realized this is the time people have to wear masks. There's no way that you can stop diseases spreading from people to great apes during this time without wearing masks. We also instituted the rule of taking temperatures before you truck, because the first index case in Uganda did not have a cough or flu, they had a high temperature. And then also no sick tourists, that has always been there if you have cough or flu, and hand washing and disinfection was really enforced. A lot of this was according to the IUCN guidelines, but it was localized for the situation in Uganda at Bwindi, and very much along the guidelines of the Gorilla Pathology Specialist Group, of which we're part of. And so when we went out to the gorillas the next day, we were able to all wear masks for the training. And the rangers were also scared of just getting COVID amongst each other. So we're able to really enforce this rule and see how they were able to reinforce it when tourists are there as well. And actually that very day, tourism was suspended as we're doing the training. And that meant that tourists could no longer come in, which was a big threat taken away at that time. But the park staff have to check on the gorillas every day to make sure they're healthy and they're not being poached. And which is a big issue now because of the lack of tourism, people are gonna get hungry. We also donated infrared thermometers, many more, to UA and at all their tracking sites where gorillas are found, and other people donated where chimps are found. So then we went out ahead and trained the human gorilla conflict team, which are people who had gorillas back when they come out. And actually during COVID, gorillas have already come out twice. We developed posters together with support from Solidaridad and ACAS Foundation. And this is the UA Community Conservation Warden, Barbara, giving them a presentation about what to do when gorillas come out. We got them all masks, which they're wearing, cloth masks. And we also trained the village health and conservation teams, which are people who go out and educate people about good health practices and conservation practices. And because it was so important about social distancing, the president of Uganda was very, very strict, the whole Uganda government, about COVID. We really reacted very well to it quickly. And as a result, we only have 500 cases to date with no deaths. So everything was done in the best way. Social distancing, it took longer, but it ensured that everything was done properly. And in the brochure, on the posters that we developed, we also included a section on preventing disease between people and gorillas. Our NGO sits on the COVID-19 task force. We are CTPH and Uganda Wildlife Authority are the only NGOs that conservation organizations which are on the task force. And so this helped us also to know what to train the volunteers in. But now COVID-19 is a big priority, and there's a lot of joint management of TB and COVID-19 patients because the symptoms are very similar. We continue to reinforce hygiene and sanitation, voluntary family planning, nutrition, sustainable agriculture, the reporting homes visited by gorillas, talking much more about zoonotic disease, importance of not poaching, even if you're hungry, in the absence of tourism. And so all of this is helping to reduce the impact of COVID-19 pandemic in Bwindi. And of course, in the absence of tourism, what can people do? Ride for a Woman was set up by a local entrepreneur, Evelyn, and her husband, Dennis. And they basically make tablecloths and nice bitenji material for the tourists to buy. And they support the local communities and they hire a lot of women. Evelyn was about to lay off all her women when I called her and said, can you make cloth masks? Because on the task force for COVID-19, CDC said, you know, cloth masks are just as good as surgical masks. And there's a shortage of surgical masks in the country. So they made cloth masks for the rangers and all the volunteers, which is great. We also thought, how do we support the farmers around the park? Because most of our customers were tourists. This photograph was taken in the Entebbe duty-free international airport, where our biggest buyer of gorilla conservation coffee, which is a social enterprise that CTPH began in 2016 to help the farmers around the park. And they stopped ordering in March, yet they used to order every week. So what were we going to do about it? So when you're tracking gorillas, you find a lady like this one picking coffee, but she wasn't getting a steady market or a steady price. So with gorilla conservation coffee, we started buying it at 50 cents per kilo above the market price. And we sold it to people, traders, roasters, and retailers. And a donation goes back to CTPH to support the community health, gorilla health, and conservation work that we're doing. And in this case, we decided to focus on the international market during the COVID-19. And we had already USA, pangos.com, were already marketing it, and Coffee House in Portland, Maine. And for coffee, where we're looking for buyers outside Uganda in the absence of tourism, and they are able to support the farmers. And Money Row Beans has already sold most of their coffee within 2 weeks of it arriving, because people want to see how they can support the gorillas, even if they're not able to visit them. Because we don't know when tourism is going to begin, because not only because it was suspended.
Okay, Gladys, you're cutting out again. So let's see if you can stop sharing your screen, I think, actually. So hopefully Gladys will come back in a minute. But thank you, Gladys. I know that was her last slide. So thank you very much. And I'm going to share my screen. I think everyone can see that now. And I think Gladys is back. So hopefully she will stay on with us. The connection needs to last just a few more minutes here.
Okay.
Thank you, Gladys.
You're welcome.
So thank you all for your really interesting and compelling presentations. And, you know, as many of you mentioned or alluded to, we know that deaths at this point, it looks like in African countries from the secondary impacts of the pandemic, you know, from poverty, hunger, and other diseases may dwarf the number of those who actually die of the novel coronavirus itself. And, you know, thinking about the SDGs and where things stand with those, a recent LA Times article said that the United Nations predicts that a global recession will reverse a 3-decade trend in rising living standards and plunge as many as 420 million people into extreme poverty, defined as earning less than $2 a day. So I think now what we would like to do is turn to Q&A, and I see several questions in the chat box, except now I've lost the chat box. Alfred, perhaps you could read one of the first questions that we received in the chat box, please.
Yeah, sure. So first question here is from Amelia. I said that correctly. And she said, I appreciate that you mentioned recognizing conservation as a protective measure against future pandemics. Can you talk more about the strategy around that? How can the argument be used within Africa and in the policies of the international community? So this is for Kadu.
Thank you. Yes, I mean, everywhere we work, we've seen that our work at a small scale in the field and the projects we run, that is so true, that as we engage communities, as communities are empowered, like Latoya said, that women empowerment, people respond and manage natural resources better. The challenge now is how to scale that up. Especially the question related to Africa, you need to remember that for centuries, Africans have been related to wildlife for many, many years. But what has kicked in now is how we measure growth and how we deal with our economies. That education is a big part of the policy work we've been doing, raising awareness, like Gladys's presentation has been, the connection and the thread in how we interact with wildlife. But I think what has worked so well is when people gainfully run enterprises that connect to wildlife management and benefit directly from conservation. Tourism is one of those, but as we've seen with COVID, it's not enough. When the tap is shut down, people can easily resort back to how poor they've been related to natural resources. So diversifying some of the benefits from conservation are so essential. Agriculture has been one of the tools we've used in a lot of projects we've done, where we've helped people connect their agricultural needs to the sources of water that is mostly found in national parks, and the ecosystem services that are required and the payment of that. And that has worked by improving bylaws in communities. That's a project we are running in southern Tanzania, that where communities have agreed to pay some of the services to communities that are conserving the water sources they need for agriculture. Engagement into other policies that govern private sector interactions and exploitation of resources. But I think as we move forward post-COVID, it's really going to be empowerment of communities, ownership of resources, bylaws on land, and policies that govern trade.
Thank you, Kadu. I think the next question that, let me scroll back up, is from Kathleen Mogelgard. I think this might be for you, Latanya. She asks, it seems that the COVID-19 pandemic is changing global perspectives on the need for risk planning and risk management. Are there opportunities to highlight the ways in which the integrated, intersectional approaches you've discussed today are effective in managing and preparing communities to cope with risk, such as the climate adaptation work that you mentioned? Thank you.
Yeah, thank you, Christian. And I know we only have a couple minutes left, so I'll try to be as quick as possible. I think we know how to support communities. I think we have to commit to it. I mentioned already how few resources actually go to helping communities prepare themselves. We've moved away from an international a model of where, there's a top-down approach that, hopefully everyone can shoehorn themselves to, into an approach where it looks different, per country, per community, per region. And those are the lessons, those are the plans that we have to support. And so when we talk about resilience, when we talk about risk-taking, when we talk about preparation, even for a crisis, we know that those live in and within the communities, and we have to support that. One of those, it means that we have to make sure that we have the right data. We have data that actually tells the stories of both what happens within genders, so whether they're male or female, effects can be very different, and we have to understand what those are. And I think our colleagues in conservation are also have highlighted very well what it means to be able to empower communities to actually deal with the issues around them, because it's what's happening with the gorillas is very specific to Uganda and maybe Rwanda, but not necessarily to South Africa, because there's no gorillas there. So I think we have to be very, insistent, that we share and support the plans that are already being made at the community level, and ensure that when there are times of crisis that we highlight that and stand behind those.
Thank you, Latanya. And we'll just do one more question. I know we're at 11 o'clock. One more question that I think either Gladys or Jason could respond to. So Sam Sellers asks, are there any lessons or opportunities that the pandemic has presented that can strengthen family planning and conservation activities over the long term, not just during this challenging period, but improve the quality and or expand the scale up of what's already been being done right now? So just a quick response.
Yeah, in fact, thanks, Kristen. I put a chat in response to this, so folks feel free to read there, just to say that long before the pandemic, we had expanded our work on trying to reach the contraceptive needs and reproductive health needs of women in humanitarian settings, something that's a real challenge. My late colleague, Jennifer Schlecht, had started asking health systems, countries, about their preparedness. Were they prepared for a disruption, whether that be natural disaster, conflict? And most health systems were not ready, did not have the plans. And I would argue that probably most natural resource management or entities don't either. And so we started working on a preparedness toolkit that countries can look to or in their health systems. And long before the pandemic, we had planned on releasing that this summer. We're working on updating it to be relevant to the current moment. But we think that as we learn from this, that more countries will start to think about how vulnerable their systems are. Thanks.
Thank you, Jason. And Gladys, just maybe just 1 minute. Thank you.
Yes, just 1 minute to say that one thing that has come out of the pandemic is the need to not just see tourism as the only financial incentive to conserve wildlife. And because tourism comes and goes, and with COVID, it's actually disappeared altogether. So there's a big need for all conservation organizations are looking at getting other alternative livelihoods that are not dependent on tourism. So farming, sustainable farming, or any other livelihoods. There's a big need to start finding other livelihoods that are not just dependent on tourism, and also to value conservation in other ways, you know, cultural or other ways to value biodiversity other than just tourism, because tourism comes and goes, and speak up. Thank you.
Thank you, Gladys. So I'm just sharing a few ways for those of you who are new to these webinars that you can follow along these discussions and topics in the future. And I put this in the chat as well. Please email globalped@prb.org to receive monthly newsletters, and follow us on Twitter at AfricaPHE. And finally, I just want to say thank you again very much to our panelists, Latanya, Kadu, Gladys, and Jason, and to USAID for its support of the PACE project, which makes webinars like this possible. And please, everyone, stay well and stay safe wherever you are. And thank you again for joining us. Take care.